Hello, anatomy friends. This is Dr. Alsop, and in this video, we are going to be discussing the bones of the pectoral girdle. So we have finally reached the appendages, and really the rest of this block, we're really focusing in on these appendages because that's where the number of bones and joints and muscles really goes up when we're talking about the entirety of the body. All right, we have four learning objectives, and we're going to start with some really big picture type of concepts before we move on to the actual bones. So let's jump right in. All right, the upper limb is an appendage, as you might imagine, and in general, the appendages are known for mobility, particularly in comparison to other regions of the body, such as the axial skeleton. The majority of the joints in the appendages are synovial, so these are freely movable. Now, the upper limb has increased mobility in comparison to the lower limb. So that lower limb through the pelvic girdle is has an attachment to the vertebral column. Remember, the sacrum is a component of the vertebral column, and you have this kind of rigid ring of bones. So this limits the mobility. The upper limb through the pectoral girdle has more flexibility since it's only attached to the axial skeleton anteriorly. So you have an incomplete ring in this region. So the mobility of one upper limb is actually independent of the other. Additionally, there is a greater ability to grasp structures from the upper limb through the hand than you have, say, in the foot. And this allows for more sophisticated fine motor skills. So really important. And one other thing to consider, yes, the hand can do these really complex movements. That's where we're getting those smaller but more precise movements. But don't forget those more proximal joints like the shoulder and the elbow. That's what's going to put the upper limb with the hand attached to it right at the end in the correct place to actually do those finer scale things. There are four major divisions of the upper limb. You're going to have the shoulder, which is the most proximal portion and overlaps with the trunk. The arm, which the Latin word is going to be brachium. This is the first true part of the free upper limb. We colloquially call the whole upper limb the arm, but that's not right. It's really just this longest portion or longest segment of the upper limb where the humerus is. Next, we have the forearm, which is also called the antebrachium. This is the second longest portion and extends between the elbow as well as the wrist, and this will contain the radius and the ulna. And lastly, we have the hand, which will include the bones of the wrist and what we generally think of as the hand, so the palm region as well as the finger area. Let's move on to the focus of this video, which are going to be the bones of the pectoral girdle. So these are the bones that will attach the axial skeleton to the free upper limb. And that's where we're getting these in-between bones. But their movements are most greatly going to affect the overall movements of the upper limb. And these have attachments and are held in place by some relatively large axio-appendicular muscles like the pectoralis major and the trapezius. The two bones of the pectoral girdle are the clavicle, colloquially referred to as the collarbone, and then we have the scapula, often referred to as the shoulder blade. So let's talk about each one of these individually. The clavicle can be thought of as the strut. So it's connecting the upper limb to the trunk. And its placement is important because it really props the shoulder joint away from the rib cage. And so that further increases the mobility in this area. The clavicle is one of the easiest bones to palpate. You may be able to feel it through its entire length because it's right under the skin in the root of the neck region. There are two major features I want you to know on the clavicle, and they are on the ends of the clavicle. So we're going to have the sternal or medial end, As its name would suggest, it's going to be more medially placed, and this is actually the portion that will articulate with the sternum, in specifically the manubrium portion of the sternum. And so you will have the formation of the sternoclavicular joint. In general, it's going to be more bulbous than the lateral end. I think of it as more rounded, but sometimes you hear people describe it as more triangular, and it will have an articular surface on its most medial part. The opposite end is going to be called the acromial or the lateral end. It's more flattened than the medial end, and this portion of the bone articulates with the acromion of the scapula to form the acromioclavicular or the AC joint. Now, you can't talk about the clavicle without talking about fractures because this bone is one of the most frequently fractured bones. In fact, in some sources, you see it as the most frequently fractured bone. Clavicular fractures can happen to anyone, but they are most frequent in juveniles or children. And this fracture can occur due to direct trauma, say a direct blow to a certain portion of the clavicle. But it's actually more often caused by an indirect force caused by a fall on an outstretched hand or a fouche injury or fouche mechanism. Fouche will come up in a few MSK areas as this is a natural way that we fall. So think about it. Think about falling down. When you start falling, one of our first instincts is to put our hand out to break our fall, which protects us from falling directly, say, on our ribs or on our head. So adaptively, this way of falling protects injuries to some of those really important organs that are deep to those bones. But the force of that fall doesn't just stay in the hand. Oftentimes, that force can travel up through the upper limb and affect structures that are more proximally located, like the clavicle. The weakest portion of the bone is going to be the mid region, so not either of those ends that we just discussed. And it is important to immobilize this area to keep the fractured ends of the clavicle from moving too posteriorly, where some very important structures are located. So if it moves too posteriorly, it may affect the subclavian vasculature or even the brachial plexus. Moving to the scapula, this bone is quite a bit larger than the clavicle and is mostly flat. The body forms most of the bone, so the body portion. And it's posteriorly located. You can palpate posteriorly and you actually feel the spine, or if you're quite lateral, you can feel the acromion of the scapula. So if you pat yourself on the back and you can feel kind of a bony projection, that is going to be the spine. And so these two structures are four of the features of the scapula I want you to know. So the spine, as I mentioned, is very posteriorly located, and it's actually a little superiorly located as well. And it's really just this posterior ridge back there, important in terms of muscle attachment. And then if you follow the spine as lateral as it can go, you're going to reach the acromion. Sometimes you hear acromion process, which flattens and it expands, so it gets a little bit larger over there. And the acromion articulates with the acromion process of the clavicle to form that AC or acromioclavicular joint. And right where these articulate, or on the acromion proper, is what many people consider the point of the shoulder. Moving a bit more anteriorly, but still lateral, you're going to have the glenoid fossa or the glenoid cavity. You'll see it either way. And this is relatively shallow for a socket portion of a ball and socket joint. And this, with the head of the humerus, is going to form the glenohumeral, aka what we most commonly say, the shoulder joint. And we'll discuss the shoulder joint in much more detail in an upcoming video. Moving more anteriorly is a projection called the coracoid process. It is located superior to the glenoid fossa. And this is an important attachment site. And it's an attachment site for more than one muscle, as well as many ligaments. Two of those muscles I want you to know that have an attachment here are going to be the pectoralis minor muscle, which is located deep to the larger pectoralis major, as well as the short head of the biceps brachii muscle. Biceps brachii is that main muscle in the anterior arm. Again, there are more muscles that attach here, but if I don't mention them, you're not responsible for knowing their attachment for this assessment. So only the ones that I do mention. All right, we have reached the practice question. Which osteological feature forms the lateral continuation of the spine of the scapula and also articulates with the clavicle? See if you can answer this one without looking at your notes. Did you pick A, acromion? If you did, you are correct. The coracoid process isn't correct. It is anterior to the spine of the scapula. It's not a part of it, does not articulate with the clavicle either. So that's out. The glenoid fossa also doesn't articulate with the clavicle, but it does articulate with the humerus to form the glenohumeral or shoulder joint. But again, that wouldn't be the correct answer. So all signs point towards A, acromion, being correct. Excellent. Thank you so much for your time and attention.